The side effects are a little different than the standard cytotoxic agents. They tend to be anything that becomes inflamed. So I tell people anything that can have an itis or an apathy can occur. So for instance, if you have an inflammation in another area, again, it's the T cells that are being activated because of the immune therapy. So T cells in other parts of the body might get irritated and might get inflamed. So if you have some cells in the lung that get inflamed, you can have a pneumonitis. Any organ system can be affected, and you can have many organ systems affected. Some of them may be very subtle laboratory changes. Let's say you have inflammation in the liver. You might have an elevation in your liver function tests, so kind of a chemical hepatitis, but it's really an immune-mediated hepatitis. Patients might be asymptomatic for a period of time, and oftentimes they won't even realize that they've got any of these inflammations of any of the area. So teaching patients that they need to report every symptom, even no matter how subtle it is very important. Even things like diarrhea. We're used to chemotherapy-induced diarrhea, in which we tell them, get Imodium at home and take Lomotil and be very aggressive about stopping it. In patients that are getting immunotherapy, that could be really toxic, and they could have morbidity and mortality from that. Because if you stop the diarrhea, what you can still have is continued inflammation and inflammatory process of the bowel, and it actually could cause a toxic megacolon. You could perforate the bowel and die. So these patients need to make sure that they're monitoring any symptom or side effect they have, and make sure they report them immediately to us and let us figure out what the cause is. Again, it may not be from the immunotherapy, it may be from another cause, but it's important that the nurses really evaluate that. Nurses, physicians, providers evaluate what the cause is, especially since these are so new as far as side effects.